लोग सेक्सुअली ट्रांसमिटेड इन्फेक्शन के बारे में खुल के बात नहीं करते, शायद इसीलिए उससे जुड़े उसके सवाल उनके मन में या यूट्यूब सर्च की हिस्ट्री में रह जाते हैं। तो आज हम जानेंगे सेक्सुअली ट्रांसमिटेड इन्फेक्शन से जुड़े कुछ सवालों के जवाब के बारे में। हाउ डू यू गेट सेक्सुअली ट्रांसमिटेड इन्फेक्शन? सेक्सुअली ट्रांसमिटेड इन्फेक्शन इज ट्रांसमिटेड थ्रू सेक्सुअल एक्टिविटी, vaginal, oral or anal sex. Sometimes it is also transmitted through skin-to-skin contact of your infected area. Can you get sexually transmitted infection through kissing? While it is very rare, but certain infection like herpes or syphilis can be transmitted through kissing if there is presence of open sore or lesion. Can you get sexually transmitted infection via oral sex? Yes. Sexually transmitted infection can be transferred through oral sex, including the infection like chlamydia, gonorrhea, herpes, syphilis, and HPV. How can you prevent sexually transmitted infection? Using the condom consistently and correctly during sexual activity will reduce the risk of sexually transmitted infection transmission. Additionally, maintaining mutual monogamous relationship with your uninfected partner will lower the risk of sexually transmitted infection. Are all sexually transmitted infections are curable? Not all are curable, but many are treatable. Certain infections like HIV and herpes are not able to cure, but we can manage it with the medication. How are sexually transmitted infections are diagnosed? Sexually transmitted infections are generally diagnosed through examination of the body fluids like urine, blood, and swabs. Sometimes it is also diagnosed by physical examination of genital or oral region. What are the symptoms of sexually transmitted infections? Symptoms of STI depend on the type of infection, but general symptoms are genital sore, discharge, pain during urination, itching and burning sensation, and sometimes flu-like symptoms. Can sexually transmitted infection be asymptomatic? Yes, many sexually transmitted infections are asymptomatic. That means infected person has no any symptoms, but still they are able to transmit the infections. How long sexually transmitted infection tests take? Time taken by STI test depend on the type of the test we are doing or laboratory processing method. Some tests are available in few days. Some tests may get result after longer time. Can you get reinfected with sexually transmitted infection? Yes, it is possible to get reinfected with STI even though you have been treated for it in the past. So practicing safe sex and regularly testing yourself will prevent you from reinfection. Can sexually transmitted infection affect fertility? Yes, certain untreated sexually transmitted infections like chlamydia and gonorrhea leads to complications that affect the fertility in both men and women, like leading to pelvic inflammatory diseases or scarring of the reproductive organ. Can you get sexually transmitted infection through toilet seat? No, it is not typical to transmit sexually transmitted infection through toilet seat or surface area. It requires direct contact with infected body fluids. Can you get rid of sexually transmitted infection through washing and douching? No, washing and douching will not cure or treat STI. You need to seek medical attention and follow the prescribed treatment plan. Can you have sex if you have sexually transmitted infection? No, it is not recommended to have sexual activity while you have sexually transmitted infection because it will increase the chances of transfer of this infection to your partner. So wait until your treatment is completed and you are no longer contagious. Can sexually transmitted infection pass from mother to baby during childbirth? Yes. Certain STI like syphilis, HIV and herpes can be transferred from mother to baby during childbirth. With proper medical care and caution, you can reduce the risk of transmission. For more such information, you can subscribe our YouTube channel.